Welcome to Recover CPR Cycles. Expand your CPR knowledge in the time it takes to do one round of BLS. This is episode 1, Interposed Abdominal Compressions. Hi, I'm Dan Fletcher, co-chair of the Recover Initiative. One of the questions I get asked a lot when I speak about CPR is about interposed abdominal compressions and whether we should be using them in dogs and cats. So I thought in this first episode of Recover CPR Cycles, we could talk about the evidence that we have for the use of interposed abdominal compressions during CPR and how to do them. Here you can see an example of interposed abdominal compressions in people. During elastic recoil of the chest, a second rescuer will apply a positive pressure to the abdomen. And the goal here is to increase pressure in the caudal vena cava to facilitate venous return to the heart. So let's take a look at the physiology of interposed abdominal compressions. We'll start with standard CPR, looking at pressures within the cardiovascular system. First, aortic pressure. You can see that during compression we get a big peak, and then during relaxation we get a drop off of that pressure. Right heart pressures, again, we'll get an increase with the chest compression, and then we'll get a slight increase during the relaxation phase because we get refilling of the right heart. And then finally, looking at caudal vena cava pressure, we really don't have much of a change at all over the course of the cardiac cycle because we're not directly involving it. How about during interposed abdominal compressions? Here we're going to see a major increase in aortic pressure both during systole and during diastole, or the relaxation phase, because of this increase in pressure and increase in venous return from the interposed abdominal compression. Looking at right heart pressures, comparable during the compression phase, but during the chest decompression phase, or the diastolic phase, we get another increase because of the compression of the abdomen. And then finally, looking at caudal vena cava pressure, the big difference here is that during that abdominal compression, we get a significant increase in caudal vena cava pressure, and that's what causes these increases in aortic pressures because of increased filling back to the heart. So when we think about this effect on the overall success of CPR, it really comes down to the perfusion of the heart, or the coronary perfusion pressure, which is the difference between aortic diastolic pressure and right atrial diastolic pressure, since the coronary circulation is served during diastole. If we look at that during standard CPR, that would be the difference between the red curve and the orange curve during diastole, or the relaxation phase, and you can see we get some flow, but that is much increased. That pressure difference is much higher when we have interposed abdominal compressions, and this is why we get better blood flows during that time. So we know the blood flow is improved, but the question is, are outcomes improved when we use interposed abdominal compressions? There are 4 clinical trials in people that are summarized in this forest plot looking at interposed abdominal compressions and the effects on outcomes. In terms of return of spontaneous circulation, which was looked at in all 4 studies, if we look at the cumulative effects across all 4 studies, there was a statistically significant improvement in return of spontaneous circulation in the patients who had interposed abdominal compressions. Only 2 of the studies looked at survival to discharge, which is summarized right here. There was a trend for an improvement in outcome, but unfortunately that wasn't statistically significant. So looking at it in total, it does seem like in the limited data we have, there's evidence of improved outcomes with interposed abdominal compressions in people. So how do we actually do interposed abdominal compressions in dogs? If you look at textbooks and on the internet, you'll see lots of pictures of interposed abdominal compressions being done this way with the dog in lateral recumbency. But if you think about that, we're really just compressing the spleen and the liver when we do this, not the caudal vena cava. Really, the approach should be more like this, where you can see someone pushing ventrally from the abdomen against the vena cava to try to achieve better blood flow. And in fact, if you look back at the experimental studies done in dogs, they typically used apparatuses like this, where we have the dog laying in lateral recumbency and chest compressions being done in lateral, but the abdominal compressions are actually done ventrally against the abdomen up against the vena cava. So now that we know where we're going to push, the question is, how hard should we push? And we can answer that by using a sphygmomanometer and a blood pressure cuff. So if you take a cuff and inflate it to about 10 millimeters of mercury pressure, and then place that cuff over the abdomen in the location we're going to apply our compressions and compress on top of it, we can target a pressure of about 100 millimeters of mercury. That will give us a caudal vena cava pressure of about 90 millimeters of mercury, which is the target that's recommended based on the experimental studies. So to summarize about interposed compressions, we know that it can improve perfusion and some data that it can improve outcomes as well. Lateral abdominal compressions are unlikely to work, again, because our goal is to compress the caudal vena cava. So we can use a sphygmomanometer and a blood pressure cuff and do compressions ventrally on the abdomen, pushing against the spine in order to try to achieve this outcome. Thank you for joining us for this episode of CPR Cycles. If you'd like to learn more about CPR, please visit our website at recoverinitiative.org. There you can learn more about our standardized online training. It's the only veterinary CPR training that was developed by the team who wrote the guidelines, is endorsed by the Veterinary Emergency and Critical Care Society, and offers CPR certification through the American College of Veterinary Emergency and Critical Care. With Recover CPR training, you can feel more confident, competent, and connected in your CPR attempts.